So first of all, my name is Amit Vora. I'm the executive lead for CPD Home. This is a brand new initiative that AMA has started. It's been 2 years in the making, and we were accredited earlier in the year to become a CPD home. And we've been so far the only CPD home that's been accredited by the medical board to provide this service. Of course, the medical colleges who used to operate in this place for a long time have continued to operate in that fashion. So in the new world, at this point in time, the medical colleges are CPD homes and us. And we believe there may be new entrants in the future, but as of now, there aren't any others. So essentially, there's a big change coming. And I guess that is what we're hoping to cover today. And address any questions you may have had around some of the changes that are coming through. So you've probably all heard about the high-level elements that the CPD standard is changing from 1st of January 24, and everybody needs to comply with the new standard. The background to this is this journey actually started almost 6 years ago. So that right after the 2016 CPD standards were implemented, I believe there was a working group that got established to look at best practice, not only in Australia, but globally. And as always, Australia does look closely at the UK model, and you may be aware, for those of you who've got colleagues across in the UK, that UK implemented revalidation a few years ago. So that was a big step. And in revalidation, I guess the benchmark for doctors needing to credential every year was very high. So the National Safety and Quality Safety Standards framework looked at that and a few other models and came up with this idea of a uniform CPD that's been implemented in Australia. The changes were announced late last year. And 2023 is a transition year, so you don't need to comply with the new standard this year, but starting 1st of January, you do need to comply with the new standards. And we'll get into a little bit of that as we go through. So one of the key changes is that for ongoing medical registration, you must join Australian Medical Council AMC approved CPD home. So that is a new requirement. In the past, doctors have done CPD for a long time, and the requirement to do 50 hours of CPD has been there since the 2016 standards. But the way in which that was done was quite different. If you were part of one of the 16 medical colleges, quite often you would have been following the program as prescribed by the medical college. And if you were not attached to a program, you were self-managing and self-reporting your CPD. So every year when you were filling out the form to renew your medical registration, which usually happens around 30th of September each year, there's a tick box which says, have you done your CPD? And doctors were self-managing and self-reporting. So in the new world, that self-reporting element has gone away, and you need to work with a third party. And those third parties are being called CPD homes, of which we are one. And the main job of the CPD home is to ensure compliance with the new standards, and we'll talk a bit more about what those standards are, and make sure you're compliant. So in a way, it is the medical board or APRA outsourcing their compliance and audit function through to CPD homes. A big part of the change is driven by the fact that the way CPD was delivered in Australia, or the way doctors did it, was not consistent. So these CPD homes will follow the new standards and ensure consistency and do their annual reporting to APRA on the doctor's behalf. So does it affect you? The short answer is it pretty much affects everybody. There's circa 136,000 doctors registered in Australia, as per the latest report. PGY 1s and 2s will be exempt, and anybody who is in a formal college-approved training program would be exempt. Pretty much everybody else in the country needs to follow these new standards and be part of a CPD home. So rough estimate is about 120,000 doctors will need to comply with this. So if you're feeling that this is a bit harsh or it's new, you're not alone. We're aware this change has been frowned upon by some, and some people have gone, this is too hard. Do we really need it? We've put together our initiative to try and make it as simple and easy as possible to support you in these changes. What are the requirements? So apart from the fact that you now need a third party, such as the AMA CPD Home, to do the reporting, there are some other changes as well in relation to what you need to do. So as I mentioned earlier, there was always a need to do 50 hours of CPD, but the way it was done was different. If you're part of a medical college, you may have heard a point system. Some people were doing it as a annual program, biannual program, or a triennium. In the new world, the medical board has simplified it in some ways and said every doctor every year must do 50 hours, full stop. And it doesn't matter which career stage, as long as you're not in one of those exempt categories of being PGY 1 or 2 or in a specialty training program, you do need to comply with the new standard. The other thing that's changed is they've introduced this concept of writing a plan. And again, we'll get a bit more into it. It sounds a bit onerous. It really isn't. All it means is at the start of the year, you have a think about what stage of career you're in or what your specialty or scope of practice is, and have an idea of what you want to do in that year around professional development. It is a living, working, breathing document. It's not write it and submit it and forget about it. You can edit it as you go along. It is based on the principles of adult learning. So in our program, it's basically a simple template. You log in, you fill out in the blanks, and it'll guide you how to do that. We even have a little learning module that you can do if you're really worried about writing a plan. I must stress this is a plan for you. It's not a plan to be audited and worked out and looked at by other people. It's really you just going, this is what I want to do for myself. Once you've done that plan, then during the year, you ideally follow what you thought you were going to do and get up to your 50 hours. Now, the 50 hours are not as straightforward as they used to be. In the past, you could do pretty much 50 hours of anything, go to a conference, read something, do a workshop, and it was all ticked. In the new world, the 50 hours are broken into two broad domains, and we'll get into a little more detail of what those domains mean. And at the end of the year, you do a bit of a reflection piece on what you wrote in your plan and say, did you get there? Did you not get there? And once you've done all of that, the CPD Home, which is us, will be tracking this all online and will submit your compliance to APRA at the end. So you don't have to do anything and you just carry on with your regular practice. A key point of difference there is that just remember, if you don't complete your 50 hours, we will actually not submit anything. So we're not required to tell APRA which doctors are not compliant. We're just required to tell them who've met the requirements. And that's because we're not here waving a stick. We're just helping people track and pass that information on to APRA. You don't have to do that. The system that we've designed will do that on your behalf. Okay. So what do these changes mean? So I've sort of mentioned this. It applies to all doctors. You can choose any AMC approved CPD home, and I touched on that earlier, which is at this point in time, the 16 medical colleges and the AMA CPD home are the only AMC approved CPD homes. You can keep an eye on their website, and there may be new ones in the future. For the first time, specialists can choose any CPD home. So again, I mentioned earlier, typically, if you're a specialist, you've been doing CPD with your respective college, you're more than welcome to carry on doing that, but you do have choice and you can choose a different CPD home if you want. Self-reporting CPD is no longer an option and you have to work through a CPD home. And the 50 hours of CPD activities must be completed annually across the two domains of learning. And this is where it starts getting a bit more interesting. And again, some people are worried that this is a lot of work, but once we've unpacked it, it's actually simpler in many ways. because the new standard allows you to record what you would normally do in your course of practice and have it count towards CPD. So the two domains are education activities and reviewing performance and measuring outcomes. And again, there's a lot of information we're covering today. Don't worry, one of the jobs that the CPD homes have is to actually guide you through the changes. And again, our system and processes will give you prompts and reminders of what you need to do. So essentially, we take the thinking out of the whole change, and you just follow the program and you will be automatically compliant. These are the domains. So I mentioned earlier that there are 50 hours requirement. So it's a minimum of 50 hours. So many people will go on and do a lot more. I might actually pass on to our General Manager of Education and Learning, Fiona. Fiona's got a long history in education. She's, in fact, the architect of our program and pivotal in us getting accredited by the Medical Council. There were over 40 organizations who applied to get accredited, and we were the only one who got off the ground. So big thanks to Fiona for not only understanding the program or understanding the standards, but actually translating them into a workable program that can be delivered on the ground. So I'll pause there and over to you, Fiona.
Thanks, Ahmed. I'll just get you to move the slides if you don't mind, because I don't know whether I can as we go through. Thanks. So thank you, everybody, for joining us. It's wonderful to be here. And as Ahmed said at the beginning, a special thank you to AMA Vic for organising and for not only opening it up to Vic members, but to members across the country. So greatly appreciated. So as Ahmed alluded to earlier, the standard, the revised standard set by the Medical Board of Australia, which went through a very long process of approvals with all of the state and federal ministers for health. There was a lot of consultation with the colleges as well to get to the point where we now have a standard. That comes into full effect from the 1st of January next year. So under that standard, to simplify it down, there's a minimum of 50 hours required each year. And there are what we call domains of learning. So the first domain is educational activities. So they're activities that you would be very familiar with. As Ahmed alluded to earlier, it's activities such as attending a conference, it could be self-paced online learning, webinar, it could be some professional reading, it could be engaging in all sorts of different things in a leadership or a management role that constitute an educational activity. So the minimum number of hours you're required to do annually of educational activities is 12 and a half. And the maximum number of hours you're allowed to do annually is 25. So it is important to remember that you cannot do, I won't say you cannot do more than 25 hours. You can't count more than 25 hours of educational activities in that domain towards your 50-hour minimum requirement. The second domain of learning is called reviewing performance and measuring outcomes. And that's actually got a co-joint title that wasn't separated out intentionally. So across those two areas, there's a minimum of 25 hours. So this is quite different to educational activities. Reviewing performance, you must complete 5 hours. Measuring outcomes, you must complete 5 hours. So we'll go into the detail of each of these in a minute, but it is important to understand that you have to do 5 hours reviewing performance, 5 hours measuring outcomes, which combined must meet a minimum of 25 hours across that domain, and then 12 and a half hours of educational activities. And then the remaining 12 and a half hours can come from either of those two domains with whatever you like to add up to your total 50 hours. Thanks, Ahmed. If you could go to the next slide, please.
Is that working? I did go across.
One more.
Oh, it's changed in my world.
Oh. Might be a lag.
All right. Still not coming through?
No, not on my screen. Can anyone else see a different screen?
No, we're on the same slide.
No, it's the same.
I might stop and restart.
Share and reshare. Thank you.
maybe we could use this time to answer a few questions while we get the
Sure.
slide deck up and running. Would that be okay?
Yeah, I'm just looking at one from Vahid. Oh, no, they're popping all over the place. I might actually address them at the end, Marty.
Okay,
They're
that's fine.
here before my eyes.
Is that better?
That's fine. Yes, we're good.
See?
Oh, good.
So is that the next slide?
Yeah, so
Okay, great.
that is the one that we need to go. Yeah.
Okay.
We've already covered the other one, which is about which organizations.
No, we're
are-
actually up to slide 10. Sorry.
Yep, this one.
Organisations. So did you talk about slide 10, which organisations are accredited by AMC?
Yep.
Okay,
Yep,
so all right, it just wasn't refreshing on the screen. So apologies. I think I've just re-talked through a slide you've already seen.
It's all
Okay.
good.
CPD made simple. So now we're up to, do specialists have to choose specialty colleges as their CPD homes? Do you want to talk through that one, or would you like me to?
Yeah, no, happy to. I guess we sort of touched upon it. Essentially, we believe most specialists will still follow the program set by the colleges, but under the new standards, you're free to choose any CPD home. And if you do choose another CPD home, your specialty registration will not be impacted. So as long as you have one CPD home and meet the standards, then you're fine. Just be aware that and we've come across a few specialists who are choosing our CPD home because they find it simple and easy to track, but they're still remaining with their college as well. If you do end up in that scenario where you've got two CPD homes, which you're welcome to have, there's nothing stopping you. Just remember, you must complete the requirements of the 50 hours and the nuts and bolts, at least with one of them, because the risk is if you do kind of half in each, neither party reports your completion to APRA, and that could be something that you get caught out on. Just pick anyone and make sure you complete the full program of at least one. If you are across or if you have multiple specialty types and you end up with the AMA CPD home, we will automatically pick any high-level requirements that are set for that specialty by the medical board. So an example might be for GPs, a high-level requirement is doing a CPR course, or for an anesthetist, it might be doing an ALS course. So it doesn't matter. If you're part of our program, we will automatically allocate those requirements to your profile. So when you first join, you will be asked to set up your profile, and the system will then automatically do that for you. And again, your continuous access to your specialist provider number or any applicable Medicare rebates is not impacted as long as you have a CPD home and as long as you're continuing to complete your 50 hours each year. And particularly, we found that people with dual or triple specialties, there are a few, find our program a bit easier simply because they can just comply with all of their requirements across the different specialty domains in one spot and still only need to do 50 hours. So this is another common question. If I've got multiple specialties, do I have to do 50 hours, 50 hours, and 50 hours? No, you don't. You just need to do 150 hours. But you need to make sure that you cover the high-level requirements under each specialty area. So again, not anything you have to think about. As long as you're on the journey with us, we will address it for you. I will probably skip that. We do provide a full support. We've got a team of dedicated staff along with Fiona and an accreditation team. So not only do we have the platform, you can call us, email us, or talk to one of our staff at any time to guide you through any particular elements. There is a very detailed catalog of learning that goes through the areas that Fiona touched upon earlier, which is the two domains of educational activities, reviewing performance and measuring outcomes. And again, the catalog or that program guide goes into specific examples of what might be applicable in your particular space or scope of practice. But at the same time, the online platform as well will guide you through that. So it's not something that you need to remember. I'll probably pause there and give it back to Fiona to actually talk a bit more about the specifics of those domains and in terms of what you need to do to start your journey.
Thanks, Amit. So I guess at the end of the day, the first thing you need to do is join. So you can, you need to subscribe to our CPD Home if you're choosing us to be your CPD Home for 2024. We have quite a lot of doctors that have obviously signed up now, and I noticed that one of the questions was if the standard is mandatory in full from the beginning of January next year, what happens in 2023? If you have subscribed to the AMA CPD Home, or you are with a specialty college already, you simply follow the CPD program of that college for 2023. That said, there are many doctors out there, for example, a doctor with generous registration that has not gone down a specialty pathway, who has been self-managing their CPD for since the 2016 revised standard came into place. So you can continue to do that this year. Even if you've signed up with the AMA CPD Home and you haven't been with a specialty college, you could elect to still self-manage. But if you're not doing that, you need to follow our program for this year and complete the 50 hours. So that's why 2023 is called a transition year by the board. Okay, so once you've joined and you've subscribed, you then plan your CPD for the year. You ideally do that within the first quarter so that you've identified your learning goals, you can tag your focus topics. That ensures that the system, once you've submitted your plan, will help you identify learning that is sitting within our catalogue that may be of interest. You can then alternatively go direct into our catalogue and complete evidence-based, timely accredited CPD activities. So any activities in our actual catalogue will have an accreditation logo on it, and that indicates that that learning has been accredited by CPD Home, and you will have your CPD recognised under our program of learning. Alternatively, you obviously can go away and engage in learning that is not available within the catalogue. So the catalogue heavily represents educational activities, not so much reviewing performance and measuring outcomes. And the reason for that is in relation to the types of activities that align with that domain. So we'll go into that in a little bit more detail in a minute. Our system allows you to keep track of your hours. We have a very dynamic dashboard. It indicates how you're going with your educational activities, how you're going with your reviewing performance measuring outcomes activities. There's also other mandatory components that you need to think about from next year or this year if you're using us as your CPD Home now. And that relates to the Medical Board of Australia's 2020 Good Medical Practice Code of Conduct for Australian Doctors, because within that code, there are 4 aspects that you need to demonstrate you have engaged in learning in. So those 4 aspects are cultural safety, addressing health inequities, professionalism, and ethical practice. So within our catalogue, we also indicate the types of activities that you can engage in order to address those mandatory areas. If you are a specialist with high-level requirements, you are also required to complete those high-level requirements if those requirements approved by the Medical Board of Australia relate to your practice. So, for example, if you are a general practitioner, you need to complete CPR once every 3 years. So there are 5 colleges in the 2023 CPD year that put forward recommended high-level CPD requirements for those specialties that were approved by the board. And there's an expansion on that. I know surgeons will fit into that category as well going from 2024. So each year the colleges can submit the learning that they believe should be mandatory for that particular type of specialist, and the board will either approve those or not, and notify CPD Homes for the following CPD year's program. Right, looking at educational activities. So I'm not going to spend too much time on this. As I said, minimum 12.5, maximum 25 hours per year. There's lots of different examples there: general learning, leadership and management, professional practice, research, teaching and assessment. I just want to pick up on the leadership and management for a moment. So if you, as an AMA member, for example, attend your AMA state or territory AGM, you can claim that as CPD under our program of learning. You might be involved in a committee, you might be on a board. They're all activities that you can add to your educational activities. Thanks, Simon. If you could go to the next one for me. Thank you. So reviewing performance. This is where we start to get lots of questions. So as I mentioned, you must do 5 hours a year. Our CPD plan that has a template that you complete at the beginning of the year and then reflect at the end of the year once you've completed the majority of your learning, equates to 5 hours of reviewing performance in our program. And that's been accepted by the AMC. So there's no questions going to be asked around that, which is a mandatory activity and a mandatory minimum hours. So by simply completing your plan and reflecting on it at the end of the year, if you are with us, you have met the minimum requirement for reviewing performance of 5 hours. Peer review, practice review, and professional review are all examples of things that you can engage in, which under our program align with reviewing performance, and there's lots of different examples in that. And they're examples of the types of activities that on the main, other than maybe multi-source feedback, you would do in your own workplace environment. Case-based discussions, there's lots of doctors that talk to us about, well, what sort of activities could I do? And they realise that they're doing case-based discussions on a regular basis. Procedural logbooks, there's all sorts of bits and pieces in there, and I want to talk a little bit more about how you go about recording those in a moment. Thanks, Simon. Then the last one for the program. So measuring outcomes, again, minimum 5 hours, maximum 32.5 hours, because you have to do those 5 hours under reviewing performance, which means that that would total the maximum up to 37.5 hours, as I mentioned earlier. So examples, improving patient outcomes, publications, safety and quality. So there's lots of different things that you can see there as working examples that you could engage in that you no doubt are doing already that would constitute as measuring outcomes. We have had inquiries from doctors who, for example, are an academic, and they're asking, well, I'm not really necessarily seeing patients as such, what do I do? A literature review is a classic example of a measuring outcome activity that they could engage in. That then leads to, well, how do you actually demonstrate that you have engaged in that activity? So it's really easy to say, yeah, I've done that, to do a simple recording in your tracker to indicate that. But as per our guide, we start talking about supporting evidence. So the supporting evidence in that literature review example would be the literature review that you would PDF and upload as your supporting evidence. Thank you so much. You've gone to the next slide. So you can see there in our dashboard, that is an example of how the different hours will collate. So it's a really quick reference for you. And you can see in that registration standard mandatory CPD activities that we've spoken about, the written plan, the reflection at the end, and then those 4 aspects that relate back to the MBA's code. And again, coming back to the types of evidence. So when you go in and you upload an activity, you can see there's a little there's a button there on that screen which talks about CPD activities. So when you're logged in, you click on that down arrow, you'll see a little upload activity click. You click through and you start to record those activities. So from next year, because we've had so many inquiries from doctors saying, well, how do I actually demonstrate that? And I talked about, well, in the literature review, you could actually upload your literature review as your supporting evidence. But what we're going to be offering from the 1st of January next year is a series of templates. So what we mean by that is, if, for example, a junior doctor is doing a clinical audit, let's say, for the very first time, and they're not sure how to go about doing that, they're getting guidance from their supervisor, but they're also wanting to understand what is involved, they'll be able to click on that, make a choice and say, do I want to use the template or do I want to upload my own supporting evidence? If they're working for an employer that says, if you're doing a clinical audit, this is what you have to do, they would go down the pathway of clicking on that supporting evidence. If they're looking for more guidance, they can fill in the fields of that template, save it over time, because you're not going to be doing it all in one go. You're going to be dipping in and dipping out of the activity. So you simply come in, make your edits and save further, so that by the end of the year, you've got your evidence there that if you're ever audited by the Medical Board of Australia or CPD Home, because all AMC approved CPD homes must audit 5% of their subscribers, just like the NBA will audit any subscriber from any CPD home. So there's two ways of being audited now. That way you have your evidence. It's done at that point of entry, and it's a quick, easy access.
Thanks, Fiona. Just touching, I did some fast typing while you were talking, and I sorted out some of the questions. But please, if what I've typed still doesn't address your question, please send your question, and then we can take it up as we go through. I just wanted to also just highlight some things. Our job here is not to hold the stick. We're here to help, support, guide you on this journey and make it as painless as possible. So there were a few questions around auditing. There were a few questions of, do we self-automatically report? And there were questions around what happens if I haven't hit my 50 hours? Well, the system that we've built, and you can see a screenshot, is designed to help you. You will get regular updates throughout the year. You'll get pop-ups coming saying, oh, it's March, you haven't written your plan. Have you thought about this? When you set up yourself on the system for the first time, it'll ask you a few questions about where you are in your career stage. And based on that, it'll automatically surface learning that's suited to you. So those sort of things, there are a lot of activities that are in our catalog already. If you consume any of those activities through the catalog, they go automatically into your record, and it reflects here in that dashboard. If you've consumed learning activities outside, and we've taken the view that learning is a broad church, and we want to make sure all doctors have choice to learn where they want, how they want, with whom they want. So it doesn't matter where you consume your learning. You could have consumed your learning overseas. You could have attended a conference. You could have gone to somebody else's workshop in Australia. As long as you have a piece of paper that says you attended, you can upload that in the upload activity, and we'll count it towards your learning. There was a question about, will that happen automatically? So yes, the short answer is it will. We built an open API where we can connect with all education providers, so that if you consume learning with them, your record here will automatically update. Now, is that in place today? No, because education providers need to do a bit of tech work to connect with us. So some have started connecting to us, and those that have started connecting with us, you will have that happen seamlessly, so you don't have to worry. Others will come on board as we progress through the year. And for them, you might need to get a piece of paper and manually upload. But this is where we are getting a bit more exciting, because we've got our new mobile app launching in the next 3 weeks. In fact, it's on my phone right now and Fiona's phone, and we're testing it, but it should be live in the next 3 weeks. What that app will allow you to do, you still need to set up your account first, but once you have an account, that app allows you to record things on the go. You might be at a session, take a photo, click a few buttons, click upload, done. You recorded that activity. You might have had a meeting with a colleague. You can record a meeting log and again record that activity. We're designing our entire system to make it as seamless and as touch-free as possible, so that as you go through your regular practice, and wherever that practice is, you can just record things on the go, and it gets counted towards the 50 hours. Again, there is other things coming in forms of templates, so it'll be quick fill in the blank type stuff that prompts you to do stuff, takes 5 minutes whilst you're at work, and it records that activity. And there'll be more and more examples of that, especially in the reviewing performance and measuring outcomes domains, because those are new domains, and we do understand that people are going, I'm not sure how this works. But the reviewing performance and measuring outcomes, you'll find, are actually the easier domains, because they quite often relate to your regular practice, and you're just recording what you would normally have done as part of your regular practice. We do have a specific opportunity for people who are not doing a lot of clinical practice. So if you're sitting on boards, you're sitting on committees, you're doing a bit of research, all of that is countable. In fact, we're working with the Department of Health and the TGA, because they've got a number of clinicians who work completely in a non-clinical, but they're doing very high quality work in terms of reviewing standards and reviewing products and services that enter the Australian market. So again, those sort of activities are easily countable and will go towards meeting the standard. Lastly, I would say is think of us or the CPD Home as a tax accountant. We help you manage and lodge what you need to lodge to get compliance with the medical board. Ultimately, you as an individual are responsible for having a copy of that record. So as Fiona suggested, you don't always have to upload the evidence. You could just make a note that you've done something, as long as you keep the evidence, because if there was an audit, you need to be able to show that you've done it. So our system does allow you to capture it as you go, but if it's too hard, you can just file it in a file. As long as you have it and you've just made a note in our system, we will let you meet the 50 hours, but you need to have the paper trail if you're audited. And
sorry to interrupt you, I apologise. I was just going to quickly say a really good example of that is when, for example, you might be at a conference and you're wanting to record your conference attendance. So you can go in, you can start uploading your activity, register the date of the start of the conference, register the hours for the conference, register the end date. So all of that's entered. And then when you receive your evidence from the conference that you attended, all you need to do is go back into that record, edit it, upload that supporting evidence, save it, and you're done. And that way, if you're audited in 5 years' time for something that you did in 2023, you're not having to ferret back through emails or goodness knows what to get that evidence. It's all actually allocated. So it's just good practice. I always think of it like my tax. If I'm doing my tax, I print my receipt and I file it because I know I'm going to need it when it's tax time. It's a great way to think about it.
Yeah, exactly. And finally, in terms of price, I know people have been asking how the whole thing works. No, a subscription price is $880. Yes, there is a part-time option of $660 defined as working less than 20 hours. And if you're an AMA member or an ASA member, it's half price at $440. Now, we do have a hub learner category. And again, this goes back to our principle of we want to offer choice. You can actually sign up as a learner to our platform for free and consume any learning that's there. You can download the certificates and take it to your own CPD home. We're completely happy with you doing that. Obviously, in that scenario, we're not your CPD home and we're not reporting your compliance and completion, but you're welcome to use the resources. Junior doctor pricing obviously is half price. Again, we've had a lot of feedback that junior doctors have reached out to us that the pricing we had proposed was too much. So we have come up with a junior doctor pricing option. And more importantly, as of last week, we've just launched our 100% money back guarantee. We're a not-for-profit. We're here to help. We basically think you should have choice and work with whichever provider that suits you. So if you join our program in 2024 and you get to 6 months and you're not happy, you're welcome to leave and join another CPD home, and we'll offer 100% refund back. That is our belief to go, that we're quite confident that the platform we've built and the support we're offering is going to be world-class.